Hi, welcome back to my channel. So in this video, we'll just go through the Pterygopalatine fossa. So first of all, you will get a IBQ based question, and then you'll be asked to know the Pterygopalatine fossa. So first of all, before I start, I want you to know that this blue portion is what is our Pterygopalatine fossa. Now we need to know the boundaries and the structures passing through various boundaries of Pterygopalatine fossa. So first of all, if you have to think of the pterygopalatine fossa, just imagine you're a person and you're standing in the pterygopalatine fossa. So what is this? So you see the maxillary teeth, right? So anteriorly, right, the person to anterior to the person, right? So anteriorly, you have posterior surface of maxilla. Now look upwards. Now upwards is superior, and this yellow portion is nothing but the greater wing of sphenoid. Now inferiorly, like downward, so this green part, which is nothing, so first I write inferior, so which is nothing but the pyramidal process of palatine bone. Then posteriorly, this, so this is the pterygoid process. Now under, like medially, so just give me a second, medially we will have the perpendicular plate of palatine bone, and laterally you will have the pterygomaxillary fissure. Somewhere here you will have the lateral part, which is the pterygomaxillary fissure. Alright, let's just go through them once again. So superiorly, obviously you will have the greater wing of sphenoid. Then let's go through the anterior part, which is this. So you will have the posterior surface of maxilla. Alright, then coming on to the inferior, the green one, which is the pyramidal process of palatine bone. Medially you will have the perpendicular plate to the of the palatine bone. Then laterally again you will have the pterygomaxillary fissure, and the posterior part is you will have the pterygoid process. Alright, now let's go through the structures that pass through it. Alright, so if I have to again draw the diagram, alright, so just see this diagram and then let's see how much we have understood. Suppose so this is my pterygopalatine fossa. Now if you remember, anteriorly I had the maxilla part, right, and posteriorly I had the pterygoid process, and upar ko I had the greater wing of sphenoid. I'll just color them according to how we had done in previous diagram, so that you don't lose the sight of what I have been trying to explain you. So like this is our pterygoid process. Alright, so let's just go through it once again. And pink part was anterior part of maxilla, right? Then yellow was greater wing of sphenoid. Just remember the color coding and like you will be sorted mostly. And blue was our pterygopalatine fossa, the star of the video. Alright, so I hope itna you know. Fine, now let's go through the communications. Alright, so I'll just write here communications. Oh my god. So yeah, so first of all you have to know that in this green part, that is the pterygoid process, we have 3 openings. Alright, which is you need to know like by heart. Alright, so 1 2 3. First one is foramen rotundum. Then we have the palatovaginal canal. Then we have the pharyngeal pterygoid canal. Now you should know the communications. Foramen rotundum communicates with the middle cranial fossa. Then palatovaginal canal communicates with the pharynx. And pharyngeal canal communicates with the foramen lacerum and subsequently to the middle cranial fossa. All right, now let's talk about here also. If you remember, we had some structure, right? So pterygoid plate, pyramidal process, right? So here also you have the two openings, which is the greater and lesser palatine canal. So this communicates with the oral cavity. Inside medially you have a foramen, which is nothing but the sphenoparietal foramen, and it communicates with the nose. This is present medially. Alright, so blue color, sphenoparietal foramen, nose. Alright, then we have in the greater wing of sphenoid also, here you have one communication. Alright, this is our orbit. So we have the inferior orbital fissure, and it communicates with the orbit. Alright, then one more thing, here you have the pterygomaxillary fissure. Pterygomaxillary fissure, which communicates with the infratemporal fossa. Alright, so I'll just mark them according to the color scheme that we have been following. So foramen rotundum, palatovaginal canal, pharyngeal pterygoid canal, then we have greater and lesser palatine canal. Alright, so this is the basic crux. Alright, so I'll just write now. So these are the communications. Alright, then just give me a second. So this is easy. Pterygopalatine fossa. I'll just go through the anatomical diagram if possible. So we'll just insert a few images. Then this schematic diagram will also help us. Then we'll go through this one also. Alright, yeah, I think this much is enough. So let's just go through first one. Just put it here, this one is here, and this one I was going to draw, but like we'll just understand it nicely. So see this diagram. So green portion is our nothing but the pterygopalatine fossa. So let's just recall. So anteriorly we have the posterior wall of maxilla, then superiorly we have the greater wing of sphenoid, then posteriorly we have the pterygoid process. This inferiorly we have the pyramidal process of palatine bone. Medially you basically can't make out, so I'll just write it, which is the perpendicular plate of palatine bone, and laterally somewhere here we have the pterygomaxillary fissure. Alright, now this is the same thing. So roof, yellow color, greater wing, anterior maxilla, then posterolateral pterygoid process of sphenoid, then medial, and then floor. Now let's go through this one. So these are the communications. So first of all, let's go through these three communications. So these three communications, see, foramen rotundum, then we have pterygovaginal canal, and we have the one more, which was the rotundum palatopharyngeal canal. I don't know where it is, so just we'll just skip it. Then medially we had sphenopalatine foramen, then superiorly we had the superior orbital fissure and inferior orbital fissure, then we have the pterygomaxillary fissure laterally, alright, if you remember. Then this is the median canal. So this is the pterygoid canal, yeah, foramen lacerum. And this was inferiorly, which was the palatine, greater palatine and lesser palatine canal, which were communicating with the oral cavity. So this is the pterygopalatine fossa in a very easy format.